I'm Tisha Larson, and I'm going to be performing the head-to-toe assessment on my wonderful patient Brittany here. We're going to go ahead and start now, and before we did her vital signs, had her empty her bladder. She did the Snell and vision chart. We checked that, and it was 20/20 without contacts. She doesn't wear glasses. Got her height and weight, vitals, and everything was appropriate. So we're going to go ahead and start. Okay, Brittany, I'm just going to start by looking at your scalp, and I'll tell you everything I do before I do it. So I'm going to look at your scalp, which for what I can see, and then I'm going to feel around in there. Now, are you having any head pain, any tenderness? All right, I'm just going to kind of feel from the front, working my way to the back, see if I feel anything, any bumps, lumps. I don't feel anything. Hair is nice and soft and thick, which is good. Okay, now I'm going to look at your face. Your eyes are symmetrical, your ears are symmetrical, looks good there. So now I'm going to palpate your bones there. Let me know if anything hurts at all. Okay, that's good. I'm going to check your temporal mandibular joint, so go ahead and open your mouth and close it a couple times. There you go. No pain? Nope. Can you move your jaw side to side, left, right? Good. And how about forward and backward? Good. All right. Any pain on your sinus, on your frontal, your frontal or your maxillary sinuses? That very well together. Good. I'm going to check your cranial nerves, so I want you to tighten your eyes tight. There you go. Now puff out your cheeks. Good. Wrinkle your forehead for me. All right. Smile. Good. All right. And now I have a couple things here. I'm going to touch you on your face with something. This is going to be the soft, and this is going to be the sharp. And I want you to tell me, differentiate what you're feeling. So close your eyes. Soft or sharp? Soft. Sharp. Soft. Sharp. Soft. Soft. Sharp. Good. I'm going to move on to your eyes. So first I'm just going to kind of palpate your lacrimal glands there, nice and soft. I'm going to look inside your conjunctiva, your sclera, they're both clear. Check your pupils. See your eyelashes are nice and turned out like they should be. So just go ahead and look straight in that there. Great, that one, good reflex. Now I'm going to check the opposite one, and that's checking for accommodation. Nice and brisk. Good. All right, so now we're going to move on to your ears. Well, before we do that, I guess I'll go ahead and check. I'm going to check your vision. So I have 3 different tests I'm going to check. One is the cover uncover. So I'm going to have you pick up a point and focus on that point and cover your right eye. Now I'm going to have you uncover it, and I'm going to watch. Go ahead and uncover. Good. Now go ahead and do that with the other eye. Uncover. Good. No strabismus noted at all. I want you to watch my pen. I'm just going to check your cardinal fields of gaze. So go ahead and hold your head still. Just watch. Good. Great. No nystagmus, so your eyes were nice, smooth movements. And then we have one more test. I'm going to have you cover your right eye. And I want you to look at me and just tell me how many fingers you see. 2, okay. 4, all right. 3, all right. 2, okay. We're going to cover, switch, do it again. 2, 4, 2, 1. Great. Now we can move on to your ears. So I'm going to start. I'm just going to look at your ears, see if I see anything. I don't see any nodules. That areas of normal color. I'm just going to feel. Is either of those tender? Nope. Anything? I'm going to look. Great. External auditory canals, nice and clear. I saw your tympanic membrane. It was nice and clear, pearly gray with a light reflex, just like we wanted. that ear, very clean ears. Okay, so I'm going to check your hearing. And I'm improvising with a fork or a tuning fork. So, it's real here. So to check the Weber test, what I would do is I'd strike the fork and I'd put it on the top of your head. And then what I would ask her, do you hear the noise to both ears the same, or is it just unilaterally? Do you hear one or the other? So that would be the Weber test. And then the Renee test is checking the air and bone conduction. So I would again strike the fork. And I would touch it back here on your mastoid process. And you would tell me how long you hear it for. And then as soon as you don't hear it any longer, I'd be counting. I would move it outside behind your ear and have you listen again. And once you don't hear the noise, you tell me again. And hopefully it would be twice as long for the air conduction as the bone conduction. So that would be the Renee. So now I'm going to just look up your nose. Good. And one nostril. All right. Your septum is nice and midline, like it should be. Nasal mucosa is nice and pink. I didn't see any redness, and I could see her turbinates. They're a little pinker, but they look good still too also. So, can you go ahead and plug your left nostril and breathe in and out? Nice and patent, no blockage. Okay, go ahead and do the other one. Good. Okay. Now I'm going to do your oral assessment. So I'm going to look in your mouth. And I'm going to look all over. I'm going to check your teeth, your buccal cavity, which is your cheeks, your tongue. Good. I don't see any caries. Mucosa, which your cheeks look good. Can you say or gag a little bit? Good. Good gag reflex. You saw your tonsils. I would call them maybe a +1. You're just, they're not red or anything, nothing to be concerned about. So next I'm going to go ahead and move on to your neck. So I'm just going to look. Looks nice and symmetrical, nice and even. I don't see any masses. I don't see anything on the skin. Next, I'm going to listen. I'm just going to listen to your carotid arteries. So hold your breath just for a couple seconds. And the other side, we'll breathe normally. Hold your breath. Breathe again, and I don't hear any bruise. So now I'm going to palpate. So good. Your trachea is nice and midline. She's got a nice little trachea, so I couldn't see it without palpating. I'm going to check your thyroid. I'm just going to feel in there. Can you swallow for me? Is that tender at all? Good. And now I'm just going to feel your neck all over for any bumps, masses. Feel anything. I'm going to check your lymph nodes. So we're going to, just start with your occipital. So back behind your neck, your preauricular, post right behind your ear there, tonsillar, submandibular, submental. Okay. I have to check your posterior cervical chain. Sorry about that. Cervical chain, cervicular. Good. I do not feel any. Right now I'm going to go ahead and check up in your armpit. So you do have lymph nodes up in your axillary area too. So I'm just going to feel up in there. Nothing. Okay. So that's good. So now I'm going to go ahead and move around to your back. So I would look, I'm just going to tie you right here. I would look, make sure I don't see anything. Her back, when she inhales, I see nice and symmetrical raise. Good. I'm going to check your costovertebral angle. So I'm going to hold my hand there. I want you to take a nice big breath. Great. Good. Now I'm going to palpate. So I'm gonna percuss. So I'm just gonna tap around on your back and just listen. Just try to tap right in between your ribs. If I hear anything real dull, that would alert me that there might be something there that should not be there that we need to investigate, but it sounds all right. I'm going to percuss now for your diaphragm, so go ahead and take a couple nice relaxing breaths. On your next inhale, I want you to go ahead and hold it. I'm going to tap you again at the bottom of your diaphragm. Okay, great. I'm just going to mark that. After a couple breaths, I want you to go ahead and I want you to exhale all your air out. Okay, hold it. Great, just keep breathing normal. Centimeters, which is normal for safety needs. Okay, so now I'm going to check for tactum fremidus. So I'm going to move my hand around and I want you to say 99. So every time I move my hand, I want you to say that. Say 99.
99. 99. 99. 99. 99. 99.
Good. And I felt a little bit up top, but that's normal. That's what we expect. I'm just going to listen. Nice, deep, relaxing breath. I'm comparing side to side. One last thing, while I'm back here, I'm just going to check your kidneys for tenderness. Are you having any tenderness on either flank side? Oh no. So I'm just going to kind of tap you a little bit with my hands. Okay. Any tenderness there? Nothing? Oh, great. I'm going to move on to your front, to your chest. So again, I would look, make sure you don't see anything, any marks on the skin, and then I don't see any lifts. She's got nice, relaxed breathing. It's symmetrical, raise of the chest. I'm going to feel again. I want you to do the 99 again.
99. 99. 99. 99. 99. 99.
Good. I didn't feel anything abnormal there. And I would also kind of feel for any thrills. Just right up under your left here, I'm going to feel for your apicals. Which is good. She's nice and thin, so I feel it easy. If I wouldn't have been able to, I'd have her lay down on her left side and I tuck my hand up in there and see if I could feel it that way. And I'm going to listen. I'm going to listen to your lung sounds first. So again, just breathe normally, nice and deep. One more. Okay, now I'm going to listen to your heart tones. So listen to the aortic. Pulmonic. Nervous point. Tricuspid. And your That's good, I could hear S1, S2, I didn't hear any murmurs, any clicks, anything like that. While we're sitting up, I'm gonna go ahead and do your arm assessment. So I'm just gonna palpate down your arm. Let me know if you, any areas hurt. Just got a good brachial pulse. I don't feel any masses. Nice radial pulse. Joints don't look swollen at all. Nice pink fingers. Immediate capillary refill. Fingernails look great. They're not peeling. They're a nice clear color. And also this one, same thing. I would just feel my way down. Feeling that brachial pulse again. Let me know if I hit any tender spots. Should come on your joints. Good. Okay. So now I'm gonna, while I have you sitting, I'm gonna go ahead and check your shoulders. So I want you to go ahead and shrug your shoulders. And I'm gonna try and stop you. Go ahead and pull it up again. Good. All right. So now I'm gonna have you lay down up here. So we can check out your belly. Do your abdominal. You can go ahead and go all the way up. Good. Okay, so I'm gonna lift your shirt just a little bit there. So start just by looking. So I'm just looking all over, see if I see any movements, which I don't see any at all. Abdomen symmetrical, I don't see any visible masses. Next, I'm just gonna listen to all 4 quadrants. Sounds in all 4. And I'm just going to listen to your pulses. So I'll listen to your aorta, the renal, the left, and making sure I don't hear any murmurs. Iliac. And the inguinal is just right under your waistband here. Good. So now I'm gonna percuss. So the same thing I was tapping, I'm gonna tap on your tummy here. Okay, so now I'm going to find the bottom of your liver by tapping. There. Go up above and kind of work my way down. Back up again. Goes right there. Sorry, take this. I got 9 centimeters. I'm also going to percuss your spleen, see if I can just way up there. Right up under there. So now I'm going to palpate. So I'm just going to lightly, and you let me know if you have any tender areas. Not feel anything with light palpation. Just going to check your umbilicus. Good. So I'm going to go a little deeper. I think I'm going to palpate your aorta, see if I can. Make sure it's not whitening. Good. All right, so now I'm going to try and palpate your liver. So take some nice big deep breaths. Inhale. I did feel it right down there. And your spleen. And don't be surprised if I don't feel it, because big breath in. See if we drop it down there. All right. So now I'm going to check and see if I can feel your kidneys, and let me know if you have any tenderness at all. So I'm to check this right one first. Just tuck my hand under there. Big breath in. Push it down it. There you go. Okay, check the other side. Okay. Alright, so now you're done with your abdomen. So I'm going to have you go ahead and sit up on the side of the bed again. So now I'm going to check your spine. We're going to do the musculoskeletal part. So I'm going to start up with your, there's your cervical spine. So I want you to go ahead and tip your head down, your chin, good. And I want you to extend your, so look up, you're going to extend, great. Go forward again. Can you turn to your right and your left? Great. Go ahead and move forward. Can you tip? Really good. So I'm going to have you turn left and right again, and I'm going to just check your strength here and here. Good. Your cranial nerves. Good. So now I'm going to have you go ahead and stand up. And I'm going to move this bed just for the purpose of the camera. Now I'm going to check the curvature of the spine. So just standing there, I'll kind of take a look here. Posture's nice, left, right. So now I'm going to have you bend over, try and touch your toes. Just check. Good, nice, even straight. Let's stand back up. Go ahead and try and holding your hips still, leaning backwards. Good. Go back to normal. Can you lean to the left and lean to the right? Good. Any pain with that? There. Okay. Now I'll have you sit down. I'm going to check the reflexes. Check your brachial first. So things I got to get you to relax here. Good. And it's nice being ambidextrous. Good. You're good enough there, so just relax that. Good. Whoop, nice one. Okay, so I'm going to take your shoes off and check your feet. Okay. And in a normal assessment, I would have, of course, I would have her pants off. And so I would check, your skin all the way down. I would check, make sure I don't feel any pulse or any masses in either leg, any tender areas. I would check for your popliteal pulse, all the way down. Check your skin, make sure there's no lesions, rashes. Check your color, the temperature, nice and warm. When I got to your feet, I would check your dorsalis, your pes dorsalis pulse, your posterior tibial pulse on both feet. I check your toes, make sure they look good. And I check your Achilles tendon that runs along there. I check that reflex. Good. Brittany, do you have any questions for me?
I think so.
All right, so that would conclude our physical assessment. So I would wash my hands again, just like I did at the beginning. So thank you.
Thanks.